Hi everyone, I am Dr. Yashavantha Kumar, consultant arthroscopic surgeon and associate professor, Department of Orthopedics, MS Rabaya Medical College and Hospitals, Bangalore. Today I will be discussing about recurrent shoulder dislocation problem. It is one of the most common problem, most often affecting young individuals, especially the sporting population. Shoulder is a ball and socket joint. The socket is small compared to the ball. Main stability is given by ligaments, labrum and muscles. Also, it is the most mobile joint in the body, in the sense it can move in all directions. Greater mobility and a small socket lead to recurrent shoulder dislocation, also called as instability. So, this is the normal anatomy of the shoulder, where it is a ball and socket joint. The socket, we call it as glenoid, is very small compared to the humeral lead, which is a ball. It is almost 1/3 of the humeral lead, so which is inherently unstable. The stability is mainly given by the muscles, ligaments, labrum and the articular cartilage. So, shoulder stability is basically, it can be a subluxation where there is partial dislocation without complete separation of the articular surface, or a complete dislocation where there is no contact between the articular surfaces. The causes for recurrent dislocation of shoulder, the most common is trauma. When shoulder dislocates anteriorly, that is in the front, it causes often injury to the labrum and the ligaments. We commonly call it as Bankhart's lesion. The first dislocation usually leads to recurrent dislocation or instability. If a first dislocation happens less than 20 years of age, then he or she is at risk of more than 90% of recurrent dislocation of shoulder. So, second common cause is hyperlaxity, where there is generalized ligamentous laxity. These patients will feel their shoulder is very loose and not stable. So, this hyperlaxity most commonly causes recurrent subluxation and instability symptoms. The third, electrocution injuries, where electric shock can lead to dislocation of the shoulder because of unbalanced contraction of the muscles. So, the fourth is seizure disorder, where the patient while throwing epileptic episodes can lead to shoulder dislocation, again because of unbalanced contraction of the shoulder muscles, most commonly the internal rotators of the shoulder, leading to posterior dislocation of the shoulder. The symptoms, usually the patient complains of recurrent shoulder dislocation, and each shoulder dislocation is very painful, symptomatic and usually requires close reduction. So, they also complain of sensation of shoulder feeling very loose or unstable, especially in case of generalized ligamentous laxity leading to multidirectional instability. Some patients also complain of pain in the right shoulder or affected shoulder. Diagnosis of recurrent dislocation of shoulder involves mainly the clinical examination. So, most of the times recurrent dislocation is diagnosed based on clinical examination, that is based on the symptoms and the physical examination findings. We do get some investigations like radiographs to assess bone loss, CT scan, better picture of bone loss, 3-dimensional assessment of the bone loss, both on the humeral lead side and the glenoid side. The MRI is the most important and the single most investigation of choice whenever we confirm the diagnosis of recurrent dislocation of shoulder. It gives detailed information about soft tissues and helps in surgical management. The treatment of recurrent dislocation of shoulder, we have conservative treatment or surgical treatment. The surgical treatment is the most common type of treatment for recurrent dislocation of the shoulder. This is best for the treatment of patients who are young with recurrent dislocation of shoulder, especially following trauma. We commonly do Bankhart's repair surgery for recurrent dislocation of shoulder, where we repair the torn or stretched ligaments and labrum to the glenoid. This surgery is commonly done now arthroscopic method. Earlier it was also done by open method, but completely now most of these surgeries are done by arthroscopic technique, that is keyhole surgery, which is minimally invasive with 2 to 3 portals. So, we also sometimes add another procedure along with Bankhart's surgery, that is remplissage, where we tighten the soft tissues onto the humeral head. So, further stabilizing the construct of the repair. So, if the bone loss is significant or the patient presents very late with multiple numerous dislocation, then Bankhart's might not work in such patients. Then we do a lateral jet procedure, which is most commonly done by open method, also done arthroscopically. In a lateral jet procedure, we remove the coracoid bone, which is very adjacent to the glenoid, and place it in the front of the glenoid, which stabilizes the glenoid, preventing the humeral head subluxating or dislocating anteriorly. Rehabilitation is reserved for patients who have generalized laxity. In these patients, surgery is the not mainstay of treatment. Often surgery in these cases can lead to failure. So, main aim of treatment in these patients is rehabilitation, that is strengthening of the soft tissues around the shoulder. Also, these patients require activity modification in order to prevent further dislocations. Thank you.